Yeah, so what we did was we used Arizona birth certificates over, I believe, almost a decade, and we linked addresses, reported addresses at birth with metrics of the quality of the neighborhood. And there is an index called the Neighborhood Deprivation Index. It's already been built and validated. And the Neighborhood Deprivation Index provides scores. And so we were able to essentially match those scores with every birth certificate in the state of Arizona for the years that we looked at. And then we looked to see if people's neighborhood deprivation index scores were associated with whether or not they had gestational diabetes reported on the birth certificate. And what we found was that women who were living in neighborhoods with higher neighborhood deprivation index scores were more likely to have gestational diabetes. Yeah, so we can improve messaging for women who might live in under-resourced neighborhoods. We can promote early screening and messaging for those women. So if you're a clinician and you treat a lot of women who might live in these areas, know that they might be at slightly higher risk for gestational diabetes, and that prior to the prior to the gestational diabetes workup, right, which kind of happens later in pregnancy, um, women in those areas could be provided with messaging on how they can maybe reduce their risk through lifestyle changes, lifestyle behaviors. So there are a lot of factors that influence GDM, and historically we have not really examined neighborhood level factors um, or neighborhood quality. So they don't really overlap. However, might be some there might be some commonalities. So if you live if you live in a poorer neighborhood, you might have less access to healthy fruits and vegetables or grocery stores where you can access healthy diet. You might be less you might have less access to walkable areas. So you might feel less safe walking, just taking a walk around your neighborhood. Um, you um, you might have poor access to healthcare just in general, right? So you might not, if you have risk factors before pregnancy, those might be underdiagnosed. So there's a lot of factors that are sort of rolled up in where you live that might be related to gestational diabetes, but this is one of the first studies that actually shows that people where they live can affect their risk. Yeah, so I think there's a lot of research that can be done. So it would be great if we did a little bit more research on individualized risk profiles. If we figured out if there were interventions we could do to high risk or vulnerable populations to prevent GDM. Um, there has to be a lot of research also on managing GDM after it's diagnosed. Women's health has been sort of an under-resourced, I don't want to say ignored, but certainly an under-resourced area of research more broadly, especially women's health during pregnancy. And the United States has some of the worst prognostic indicators for women's health during pregnancy in the developed world. And a lot of this is because we just lag behind on research in women's health in general, including GDM.